The difference between the Fuji CR cassette and the film imaging cassette is the imaging plate that looks like the white crystals of the old film-based cassette. However, the difference is, in film, when these cassettes were hit with radiation, those crystals would glow right away, which would then expose your film. You feed it through the processor and you get a silver film. However, in digital imaging, when these cassettes are hit with radiation, those crystals stay in a charged state until we feed this cassette in the scanner unit. It extracts that imaging plate, and then those crystals are hit with a laser, and then they glow. That image is read digitally, and then the imaging plate is erased for reuse and fed back in the cassette for multiple exams. For cassette selection, we want to use the smallest cassette size necessary for the anatomy that we're most interested in. So for example, if we were doing a small extremity, the 10 by 12 or the 8 by 10 would be fine. If we're doing a larger extremity, we might need to grab a 14 by 17 size cassette. When positioning the cassette, we want to get the anatomy that we're most interested in the centermost part of the cassette. We can still do the split plate view. The Fuji software will recognize 2 images on one plate or even 4 images on one plate. However, if we're only doing the one image, we want to get the anatomy in the centermost part of the cassette. Additionally, for positioning, this green strip becomes our identifier as far as orientation. With film-based cassettes, we had a lead blocker for the ID printer, which is no longer necessary. So the green strip at the top can be positioned towards the patient head or their right side for identifying orientation on the viewing monitor. When doing tabletop exams, there is an option to use a plastic bag that's radiolucent to protect the cassettes for any fluids or trauma that might occur on the tabletop. Doing under the table exams, the bags are not necessary. When using the cassettes for exams, we want to collimate down as best as possible to the anatomy that we're most interested in. The old style left-right markers that were clipped onto the cassette are no longer recommended because it forces the collimator to be opened all the way. But again, to get the best image quality, collimate down as best as possible to just the anatomy of interest.